Thank you, Larry. And yeah, professionally, people call me William. You can call me Bill. Most people do. And we're going to talk today about government assistance programs. But before I do, I kind of want to plug IDF and their advocacy efforts because that's very important. We have a budget proposal that just came out a couple of weeks ago that's talking about some pretty serious changes to the programs we're going to be talking about today. The budget proposal tracks some of the changes that were made in the House of Representatives bill that they passed into the Senate, which would, among other things, result in significant cuts to and restructuring of the Medicaid program. As far as the other programs we'll be talking about today, they want to cut at least, talking about cutting $880 million in Medicaid and $72.5 billion in cuts to Social Security disability insurance, which is what we're going to be spending a lot of time talking about. This would effectively cut those programs in half. So it's very important that if you're not already involved in advocacy efforts, that you take this up because this is you that they're coming after, okay? You need to understand that. So on a more cheerful note, we are going to be talking about government assistance programs, including Medicare, Medicaid, Social Security disability, and supplemental security income. And by the end of this session, you will all be experts on these programs. You will know everything there is to know about these programs. That's a lie, okay? What I'm going to do is I'm going to give you an overview of those programs. That's why we encourage questions in these sessions, because most of these programs have rules and then exceptions to the rules and then exceptions to the exceptions to the rules. And so the answers really vary according to your particular situation. Let's see. Oh, there it goes. So right now we're going to talk about your health care choices subject to change. What we're going to be talking about is, first of all, Medicare. There's what's called traditional Medicare. You may have heard referred to as Medicare A and B. That's hospitalization and doctors. There are also other things called advantage plans, supplements, drug plans, all of which add on to traditional Medicare. There is Medicaid, which is for people who are below federal poverty level in most instances, in some instances a little above that in certain states, and also children's health insurance plans, which are also, I'm hearing, possibly on the chopping block going forward. Continuation of your group health coverage under COBRA when you stop working. That's an option for continuing the insurance that you already have at a much higher price than what you're currently paying through your employer. And then the individual and family health insurance plans offered through the marketplace created by the Affordable Care Act, also potentially on the chopping block, or some alternative to that, perhaps. We're still waiting to find out what the alternative might be. So the basics on Medicare, it pays a portion of your hospital and medical costs, but it also leaves you with some pretty good out-of-pocket costs in addition to that, particularly if you don't have any kind of secondary coverage or a supplement of some sort. There is no prescription drug benefit in traditional Medicare, although you can purchase that, or you can purchase plans that include prescription drug coverage. There are two and only two ways to qualify for Medicare. You either must be over the age of 65, or you must have been found disabled by the Social Security Administration. And for that last option, you have a waiting period of 29 months from the time that you're found to have become disabled to the point that you become eligible for Medicare. And we're going to talk about, well, what do I do to fill that gap? There's an answer. It's not a very good answer, but I'll tell you what the answer is. So we talked a little bit about this already. Part A is for, there is no premium for it. It's automatic, and it's primarily for hospitals and inpatient treatment. Part B is optional. You don't have to take it, but they also will charge you a premium for it, and that's for physicians, medical costs, clinics, anything that's basically not a hospital. In many states, if you have either Part A or Part B, you can purchase a Medicare supplement. Here's where it gets complicated. If I'm over the age of 65, I have a right to a Medicare supplement, and that's true across the nation. When we talk about people under the age of 65, it varies from state to state. Some states require that they offer you a Medicare supplement, some states do not. And so it can also be much more expensive than the policies that are available for retirees. The other sort of wrinkle on that is that once you've crossed the threshold and you've gone from the point where you're getting Medicare because you're disabled and they convert you over to retirement, you can actually restructure your Medicare supplement at that point and possibly get a lower cost plan. Okay, Medicare Part C. This is for, and you hear it called different things, Medicare Advantage plans, Medicare Complete plans. Way back in the day, we used to call it Part C because it's like we would talk about Part A and Part B, and then we would skip the D, and everybody would say what happened to C. It's kind of been submerged into all of that. As I mentioned, some of these plans will include prescription drug plans, and they also include coverage for things that Medicare does not cover, like hearing aids, vision, dental, and so forth. There are also limited provider networks in some of these plans that will allow you to get additional benefits in exchange for your agreement to only see certain doctors in order to get full reimbursement. And then Part D, which is the prescription drug plan, which some of you may be familiar, familiar with already. These again vary from state to state. It's voluntary, but if you don't sign up when you're first eligible for Medicare, your premiums will go up 1% per month for every month that you didn't sign up. People who have both Medicare and Medicaid are automatically enrolled in a prescription drug plan, and they will choose one for you if you don't choose one for yourself. So you want to be vigilant on that. Medicaid is the other program. Now, Medicare, we'll talk about where that comes from. It comes from, as we said, Social Security disability or being over age 65. Medicaid is a slightly different animal. First of all, what it covers. Medicaid covers most medical and hospital expenses at little or no cost today. There are increasingly efforts to put in co-pays and patient responsibility requirements for Medicaid services as well. It's administered jointly by the government and the states, and this is where the push and shove is coming, because the feds want to basically devolve everything back to the states again, so that the states can tell you you can't have Medicaid coverage. Here's the thing about disability: is if you're found disabled, again, in most states, if you're eligible for at least $1 worth of SSI benefits, you're automatically enrolled in Medicaid. Other states will have you go through a stricter financial qualifying process in order to qualify for Medicaid, and there are other ways to qualify for Medicaid. There are things like Medicaid spend downs, Medicaid for pregnant women, Medicaid for certain families. It depends, again, what your particular state has done. Medi-Cal has a lot of things that they've added on to their Medicaid program that you don't find in other states, for example. Now, the Medicaid expansion under the Affordable Care Act allows some states to expand Medicaid to people up to 138% of the poverty level. Traditional Medicaid was limited to 100%. In the states that decline Medicaid, there's a coverage gap, which means that you can't get anything because you can't afford the marketplace plan. In fact, you can't even sign up for it because you're supposed to be in the gap, and there's nothing to fill the gap in those states. We do not know at this point what the future of the Medicaid program is. As I said, it's being negotiated now in D.C. Children's health insurance program is for children. Don't see, well, we might have some parents here. This is low-cost health insurance for children where you have too much money to qualify for traditional Medicaid. And this is also the program that covers parents and pregnant women as well. This is also something that if you go through the Affordable Care Act Marketplace website, they will see if you're qualified for that. So if you have questions about it, you go to healthcare.gov, put in your info, and you'll see if you're eligible for it or not. And let's move on from CHEB. Okay, COBRA. Okay, earlier I was talking about that 29 months that you have from, excuse me, the time that you're found disabled to the point that you would receive Medicare. The basics on COBRA is that it only applies to certain employers. You have to tell them that you want it, and you have to pay for it. And as we talked about, it's a lot more expensive. They can charge you up to 102% of the cost of the plan. And if you get an extension, which we're going to talk about, up to 150% of what the cost of the plan is. And this is where the extension comes in. You can get the initial 18-month period extended for an additional 11 months if, big if, you're found disabled by the Social Security Administration within 60 days of the date that your employment terminated. You haven't yet run out of your 18 months, and you notify the COBRA provider in writing that you want the extension. And that would theoretically fill the gap from the time that you stop working to the point that you become Medicare eligible. The trick is, how do you afford it? Here's a question that comes up now a lot because of the backlog with Social Security appeals. It's taking a lot longer than 18 months to get a determination. So your COBRA has already run out by the time you get your Social Security decision. Currently under the marketplace, that qualifies you for open enrollment, where you can sign up for a marketplace plan under the Affordable Care Act. You only qualify in the situation where the COBRA has actually run out. If you drop it because you can't pay for it, you're not going to get the open enrollment period. And then the marketplace will determine, whether you qualify for a qualified plan, Medicaid, or Children's Health Insurance Plan. As I said, the Affordable Care Act healthcare.gov is sort of the clearinghouse for finding the information about what you're eligible for those types of plans. This is open enrollment for Affordable Care Act, and it does talk about the fact that your coverage does not need to be exhausted to enter the marketplace during open enrollment. So during open enrollment, you can sign up for an Affordable Care Act plan for as long as the Affordable Care Act continues, which, again, we're waiting to see. I want to go ahead and skip ahead a little bit. Basically, what we do at Access is we try to keep you on track and look at the different healthcare options that are available and sort of walk you through what works in your particular situation. And it may be any one of these or some combination of them. It kind of goes back to what we used to call healthcare hopscotch, of like, well, I'm going to go on COBRA, and then I'm going to go on Medicare, and then maybe at some point I'm going to qualify for a different type of plan. And so there's always going to be different options out there. And again, the other sort of wrench in the works is legislative change, where what's available today may not be available tomorrow, but we may have some other choice available on down the road. Now, I want to talk about Social Security disability and supplemental security income because, as I said, these are the ways that you qualify for these health care programs, Medicare and Medicaid. They're two different programs, although they have the same rules for medical determination. They have different rules for what they call the non-medical determination. And as I said before, the rules can actually get pretty arcane on some of this stuff, so I'm going to give you sort of the general overview of it. Social Security disability is for people who have a work history. Generally, you must have worked at least 5 of the last 10 years in order to qualify for Social Security disability. Things like the property that you own, your income, do not affect your eligibility for Social Security disability, so it's not a poverty-based program at all. You might want to think of it as like your automobile insurance. It's something that you pay for through payroll taxes. So this is a benefit that you are entitled to because you have paid for it. And the monthly benefit is based on how much you earned and how long you worked and paid into the Social Security system. Supplemental security income is a welfare program. It is means tested. It's for people who are too young to work. Children do not have a work history, so the only disability program available for children is supplemental security income. You have to have very limited financial resources, and the property you own does affect whether or not you're entitled to benefits or not. Social Security disability has a 5-month waiting period. If I become disabled today, I would not be entitled to collect my first check until 5 months down the road from today. So basically November, and it has to be 5 full calendar months, so actually December of this year would be my first month of eligibility. However, if I become disabled on this date and don't apply until sometime next year, I can retroactively go back to that date in December up to 12 months prior to the date that I applied. And then, as we talked about, 24 months after I'm eligible for my first check, I would become eligible for Medicare. So there's waiting periods involved with that. Supplemental security income does not have a waiting period. It basically kicks in the month after the month I become disabled. However, they do not pay past due benefits. And as we talked about, it's that $1 worth of SSI benefits that in the majority of states will qualify you for Medicaid. In some states, you have to apply separately, and the financial guidelines can be different. Sometimes you can be eligible for both. That's a situation where you've worked and you paid into the system, but you never earned that much, or maybe you're a very young worker where you just haven't had the opportunity to pay that much into the system yet. In those situations, you may become eligible for both supplemental security income and Social Security disability. And what they do in that situation is that they will also qualify you for Medicaid right away, and then somewhere down the road you may become Medicare eligible as well, which can introduce its own set of complications, because if you're used to having Medicaid pay for everything and suddenly Medicaid disappears, now you're left looking for a Medicare supplement and all the other things we were talking about earlier. So up to this point, I've been talking about how the programs are different. How they're alike is what I'm going to spend the next part of my discussion on. They have the same medical rules, and there's a 5-step process that Social Security goes through to determine whether or not you're disabled. The official definition of Social Security, the Social Security gives for disability is the inability to do any substantial gainful activity by reason of any medically determinable physical or mental impairment, which can be expected to result in death, which has lasted or can be expected to last for a continuous period of not less than 12 months. So it has to be something that will stop you from working for at least 12 months in a row. This is the 5 steps. The first one is, and by the way, I see people taking pictures. I meant to tell you that at the top of the presentation. I have a PDF file that if you just send me send me a request to my email address, I can send you a copy of this presentation by email. So don't. I'm sorry? I know, because I know that I've got, and I'll tell you the reason why I'm moving fast, because this presentation is kind of dry, quite honestly, in case you haven't noticed. And what I find is that I get more out of being able to answer questions than I do from sitting up here and reading to people. So I do try to get through the presentation fairly quickly so we can get to questions at the end. But like I said, I do have this presentation available in written format, so if you just I'll leave my contact information up. It's on the last screen. I'll leave that up at the end. That's what you want to write down is my email address. Okay? So y'all can stop taking notes now. Okay? All right. I know, and the truth is it's taken me a while to get into the groove and slow down a little bit to talk, so bear with me here. As I said, the 5-step process, substantial gainful activity. I'm going to go through and talk about each one of these separately a little bit. The second step, does the person have what they call a severe medical impairment? Does the severity match what they have in the regulations and what they call the listing of impairments? And then if the answer to that third question is no, then we go on to the 4th and 5th steps, which is whether or not they have the ability to perform past relevant work, and if, given their age, their education, and their work history, their condition is so severe that they can't do their past work, would there be any other kind of work that you could possibly perform?
Who makes that determination?
Initially, and we're going to talk about that, but initially it's determined by a state disability determination service. And I should say, first of all, please reserve your questions towards the end. They want written questions, not questions from the audience. The question was, who makes the determination, just to repeat it for the recording. Initially, it's determined by a state disability determination service. We're going to talk about statistics in terms of how often they will turn you down, which is pretty often. And then you get a right to appeal. And then you can go up from the State Disability Determination Service to the Office of Adjudication Disability Appeals, which is a federal agency. Those are administrative law judges who work for the federal government. And then from there, if you get turned down, you have another administrative appeal up through a panel of judges in Falls Church, Virginia, called the Appeals Council. And then from there, if you choose to do so, you can file suit in federal district court and sue the Social Security Administration and go up the ladder all the way up to the Supreme Court. So you have a number of appellate rights. We're going to talk about where most cases are won, which is somewhere short of the Supreme Court. So the first 2 steps, what do they mean by substantial gainful activity? As of this year, your gross earnings have to be at or below $1,170 a month. If you're working and grossing over that amount, they won't even look at your medical records. They're going to say that your earnings alone are too much for you to be able to qualify. And so what that also tells you is that you can work a little bit and still get Social Security disability benefits. What's a severe impairment? Anybody in this room that has primary immune deficiency has a severe impairment. It's anything that has more than a slight effect on your ability to function. So almost anything can qualify as severe impairment. The third one actually brings me back to cheerleading for IDF again, because this listing was changed as a result of some efforts that IDF made some years ago to educate Social Security about what immune deficiencies are really like. What the listing of impairments does is it's kind of a list of different medical conditions and gives clinical criteria that says if you meet these clinical criteria, we'll find you disabled without making you go through those additional 2 steps I was talking about. And there are separate listings for adults and children, although the trend has been to, it used to be children's listings were a little more liberal than the adult listings. They're now almost identical. There's very little difference. If you do not meet or equal a listing, then we go on to steps 4 and 5, as I've discussed. The listing for primary immune deficiency today comes in 3 parts. The first part is based on what the original listing kind of sounded like, where they're looking for infections. It used to be repeated infections. They had to be severe, but they didn't define their terms. Now they spelled it out. They have to be resistant to treatment and require either hospitalization or intravenous treatment 3 or more times in a 12-month period. Now, when this listing first came out, we thought, oh boy, IV treatment, maybe they mean IVIG. In context of the way the regulation is written, they mean IV antibiotics, okay? Because that's the equivalent of hospitalization, having to do IV antibiotics. And then they give you a list of like the specific infections that they're looking for. The one that is the one we most often talk about, obviously, is sinusitis. Because for most folks with primary immune deficiency, that's the one that you typically have over and over again every year. But if you're having some of these others, that can also count towards that 3 per year that they're looking for. And then looking over a 12-month period of frequency of infections, that's only one possibility. Okay, there's actually 3 different ways to qualify for the listing under primary immune deficiency. The second one was one that was added as a result of IDF educating Social Security about SCIDs, severe combined immune deficiency, where they started talking about people who require bone marrow transplants. And they say that you're disabled for at least 12 months after you've had a bone marrow transplant. And then the third one is the one that was added as a result of feedback directly from people like you, because Social Security did not understand that even with treatment, people still get infections. Even with treatment, fatigue is a big problem. Even with treatment, there are still days that you don't feel real good, even if you're not necessarily carrying an infection. And so at that point, they say, well, this is what we're going to come up with. And so now they're talking about less clinical criteria and more functional criteria, saying, well, okay, if you have at least 2 of those constitutional symptoms, and the way I usually explain it is that fatigue is just being tired, which is kind of if you're on IV, for example, that getting into like about the second or third week, your energy just runs out. You just run flat. It's like air leaking out of a tire. That's the fatigue aspect. When you get the infusion, oftentimes you have achy flu-like symptoms. Malaise is what I call the feel like crap syndrome. Okay, so you have the 2 constitutional symptoms. Now all we're looking for is, does that produce marked impairment in at least one area? And the areas that they talk about are activities of daily living. A good example of this one, excuse me, is I can get the laundry into the washing machine today. It may get into the dryer tomorrow, and then by Wednesday I probably have it folded. But wait, ladies laughing here, you know what I'm talking about. Yeah. Okay, so that's an example of an activity of daily living that is markedly impaired because other people do it differently. You do it the way you do it because that's what your body allows you to do, okay? Maintaining social functioning, particularly with immune deficiency. A lot of people say, I really don't go out much anymore. I don't go to the movies. I don't go to restaurants. If I'm going to be someplace where somebody wants to shake my hand, I make sure I bring hand sanitizer with me. And I don't go to church anymore because there's too many sick people there. So those are examples of limiting your social functioning to an extreme to avoid getting infections. And then the final one is completing tasks in a timely manner, and that could be different things. Some people with immune deficiency find that their ability to remember and to process starts to get kind of foggy, where it's hard to concentrate. It's hard to focus on what you're doing. Again, if you have marked limitations in that area, that can be a basis for disability. So that's the listing of impairments. If you meet the listing, we stop because you've won your case. That rarely happens. The real deal here is that in a hearing, I'll run through the listing with the judge, and the judge will, nod and, say, yes, that's very interesting, and let's talk about your vocational profile. But what it does is it softens them up because it makes them realize that, I'm dealing with more here than just somebody who has occasional problems with infections, because we're now talking about the infusions, the side effects of the infusions, the fact that it does not eliminate your infections. It reduces the frequency and the severity, but you still get sick, okay? And that gets into the vocational profile. So for steps 4 and 5, what they're looking at is your age, education, your work history over the last 15 years, And then they say, well, can you do any work that you've done before, even though you're really sick now? If you can still go back to work that you've done previously, they'll turn you down, okay? So the first question is obviously, could I do any work that I've been doing up to this point? And then finally, at step 5, if you can't go back to work that you've done in the past, would there be other types of work you can do? One of our favorite examples from the vocational experts about sedentary jobs that don't require a lot of training and don't require contact with the public and don't require the various things that supposedly a person with immune limitations would have is what they call a security monitor. And as they describe it, it's kind of like that television commercial where the guy's robbing the bank and the guy comes out and says, I'm a security monitor. I don't do anything. I just tell you there's a bank robbery. Okay. In the vocational expert's mind, the security monitor sits there and looks at a bank of TV screens, and if he sees a problem, he picks up the phone, he calls the security guard, who goes out and handles the problem. That's not realistic. In today's economy, most security monitors are at your local airports screening luggage. They're standing up, not sitting down. They're having lots of contact with lots of very angry public people, and they are expected to do other things besides just look through it, look at the screen. They're expected to actually handle an emergency. So, but that's the kind of make-believe analysis that they'll go through with residual functional capacity. Here's the issue, and this is what you need to understand if you're going to go through this process. This is the one word that if you want to write a word down, write it down. The word is attendance, okay? Because any job that we talk about, and it doesn't matter whether it's unskilled, skilled, whatever it is, they want you there 8 hours a day, 40 hours a week, without more than a couple of absences per month. This is where if you're on either sub-Q or IV, that's a big deal because most people are not going to be able to work on their infusion day. Excuse me. And so I tell people going in, it's like, understand that the issue in your hearing is going to be whether or not you can work consistently. A lot of my clients are still working a little bit. They just aren't working full-time. And the thing is that they can't work full-time. They try, and they get too sick to do it. And so that's where we come back to, no matter what jobs they come up with, security monitor, sorter, there are a range of jobs that they like to talk about, but all of them expect you to be there. And if you can't maintain regular attendance, that's an essential duty of any job, and therefore you should be found disabled based on the fact that you cannot maintain regular attendance. So disabled doesn't mean bedridden. Disabled doesn't mean I just can't do anything. It means I can't do it consistently. I can't do it on a reliable basis. And the big thing with immune deficiency is that if I get an infection, it's one thing to say, yeah, I'm going to have my infusion every Thursday, and so, excuse me, I need that day off. I cannot safely say, yes, I'm going to need next Thursday off because I'm going to have an infection that day, okay? So it's unpredictable absences in particular that employers do not tolerate. Sorry. We're getting close to the end here, and then we can really slow down. So applying for disability. The easiest way to do it these days is online. There's a website, ssa.gov. You can actually do the application online. You can call them toll free. You'll get a phone tree, but eventually you do get a live person. Or if you're really brave, you can call or visit your local Social Security office. For people who are immune impaired, I do not recommend the third option. Who decides your claim? The question I got earlier. As I said, it's initially decided by State Disability Determination Service. Most parts of the country, if you get turned down the first time, you go through another level of the same state agency, and they do something called a reconsideration. Reconsideration is typically what I call a bad decision fast. It's almost always against you, but it comes pretty quickly. And then the last step in the administrative process for most people is where they have the hearing in front of the administrative law judge. And that's where most cases are won, as we're going to see here in a few minutes. The bad news is that it's taking a long time to get hearings because of the backlog. There are a lot of people that are waiting 18 to 24 months to get a hearing date from the time they're requested. That's a big problem if you're on COBRA and your COBRA is running out, okay? Okay, this chart may be a little bit hard to see, but this is basically from the last fiscal year of how many claims are allowed and denied at each level, and I'm going to read off the relevant parts of it. For the initial level, which is the very first one where people go in, and last year they had about 2.5 million applicants. They allowed 33%. The other 2/3 were told no, and they were turned down. So people who think that it's easy to get Social Security disability, show them this chart. It's not that easy. So yes, the next step we have is the Appeals Council. Notice the drop-off here. We had 2.5 initial applicants. The people going up on appeal, about 600,000. Most people take no for an answer and walk away. Okay, that's a mistake, because the reconsideration, first of all, it's the step that you have to go through in most states, although they're talking about possibly bringing it back for everybody. This is, again, the same agency that turned you down the first time. They allow 12% and deny 88%. So it's a rubber stamp. It's a worthless step, in my opinion. The judges, interesting story, today the judges are approving about 46%, so a little bit less than half. Dismissal rates are way up, and that has to do with a lot of different factors, some of which involves people going back to work even though they're sick because they just can't tough it out anymore. And then they turn down 35%. So, that's not terrific, but it's better than the earlier two levels. We talked a little bit about the Appeals Council. That's another rubber stamp. They allow 1%. They dismiss 4%. They remand or send back to the local office 13%, and they turn down 82%. And then finally, we have people who file and go into the federal court system. The courts are not that great either. They only allow about 2%. So most cases, if they're going to be one, are going to be one at that middle level, the administrative law judge level, where you have a hearing in front of a local judge in or near where you live, typically. This is a chart I put together to kind of show you where the trend has been. The one all the way over on the right-hand side is the most recent numbers we have, which is for 2016. And as I was saying, they allow 33%, turn down 67% at the initial level. And you can see that it's been pretty consistent across the years, that it's been in about that range since I started tracking this back in 2008. Same thing with the reconsiderations. It's been in the 85, 86% denial range pretty much consistently. But look at what happened with the judges. Back in 2008, the judges were allowing 63%, and it steadily declined ever since then, now down to 46%. What you need to understand is that there's a lot of hostility coming out of Congress these days towards the disability program, and they are putting pressure on the judges to stop approving so many darn claims. And they will actually call judges in who have a approval rate that's too high and call them on the carpet. And there have been some hearings like that. They also have, these judges supposedly have what they call decisional independence. But if you're an outlier, if you're approving too many cases, I haven't heard of them doing this if you deny too many cases, but if you approve too many cases, they'll bring you in for counseling, for retraining, to teach you to stop approving so many cases. So, things to consider. The first thing I tell people is that you should file for disability as soon as you think that you're possibly going to qualify. Don't wait for the 5 months to run. Don't wait for, maybe you're going to get better. Go ahead and file. There's no penalty for withdrawing a claim. If things turn out where you can go back to work, terrific, go back to work. But because of the amount of time that it takes to get a claim through, I tell people as soon as you think you might be disabled, file the claim. Like I said, you can always pull it off the table later. Surviving financially, this is a big deal. That's really one of the first things I talk to people about is like, look, is this the situation? You may well end up, and for primary immune, this is almost always the case, you're going to end up going through an appeal process. It's very rare for primary immune to get approved at the initial or reconsideration level. It almost always goes to hearing. And because it almost goes to hearing, that means that I have my PI clients for a good 2 years, often, before I finally get the case resolved. In that situation, we have to talk about how are you going to survive financially. If you don't have any income coming in, is there someone you can live with? Is there someone you can borrow money from? I've had adult parents move in with adult children. I've had a woman who moved in with her aunt. They do what they have to do in order to survive financially until they can get the ruling that they're looking for, but it's a real problem. One of the things that you can do in that situation, though, particularly if you're worried about paying for your insurance, is that there are patient assistance programs like Patient Services Incorporated that can provide financial assistance to at least cover your health insurance premiums while you're going through this situation, particularly this extra high COBRA premium. So there are ways to deal with it. You just have to look at what options are available in terms of being able to get the assistance you need to survive financially until you can get the decision that you're entitled to. And that was healthcare coverage. We talked about that. Talk to your doctor. And my time's running out? Okay. That's why I was going so fast. Talk to your doctor. Make sure your doctor understands you're applying for disability. Social Security, well, it used to be by law, Social Security had to give great weight to what your doctor says. Now they don't have to give it so much weight anymore. They just changed the rule on that. Again, this is another example of what I'm talking about things getting hostile. Let me go through. As I said, this is stuff that we can send you. Yeah, okay, getting approved. Averaging all the different levels out, only about 4 out of 10 disability applications are ultimately approved. So 6 out of 10 get turned down and never get approved. And that's, again, based on the most recent numbers that we have, broken out by the levels we talked about. Yeah, okay, that's it. The nice little splash screen for my programs, advocating for chronic conditions, entitlements, and social services. And that's my contact info. We made it to the last slide, and I almost did it in time. Okay, so now we can really talk. Okay, let's go to the
I know that we don't have a lot of time, but we can try to get through a couple questions here. Anything that we may not answer, I don't know if you have time, William, to hang around afterwards.
I'm here. So I
okay, I have to be elsewhere, so
I don't know. Is there a session coming in after this or not?
You can always go out in the hall.
Okay, all right.
So I'm going to read this first one. It says, when it's time to sign up for Medicare in California, are there preferred supplemental plans to sign up for CVID, or how do I find out about infusion coverage before you sign up for a supplemental plan?
A couple of
You need to come to the next session.
Okay.
I'm sorry. If you haven't been to I did a health insurance session earlier. There's one at 4? 3:15. I don't even know what time it is. But we will go over this in a lot of detail.
Okay. Just a quick answer to that. A couple of possibilities. First of all, every state has what's called a state health insurance assistance program that can walk you through what plans are available in your state, or in the case of California, what's available in different parts of your state, because Northern Cal and Southern Cal are different markets. And they can give you sort of the broad picture of what's available. The other best resource is IDF and your fellow patients who are on Medicare, because they can tell you, well, I'm on this plan and it really isn't very good, or I'm on this plan and it's doing pretty well for me, particularly in terms of treatments. Again, some may be better for one therapy than another. It really varies a lot. So you can get sort of the general information from the state agency, and then your best resource is your fellow PI folks who can tell you what's working for them. Okay, okay, this question is, if a 42-year-old was denied disability due to the fact he said he works because he couldn't afford to be off anymore, can he reapply now? Realizing his statement
Maybe realizing his statement may have had an impact on
denial?
denial?
Well, here's the thing, is that it depends on how far you went in the process. If you went all the way up to the administrative law judge level, that decision becomes final, because you can't go back and sort of reopen that period. Well, under rare circumstances you can. But it sounds like it's the person who went to hearing, because they said it was based on a statement he made. You would have to have some extraordinary circumstances to reopen that time period. You can always say, well, I'm disabled now. You just wouldn't necessarily be able to go all the way back to the date that you stopped working. It would go back to the date after the date you had your hearing in front of the judge as the first date that Social Security could approve a new claim. Okay.
This question says, I thought that the FMLA covered members in our community when they have a pre-existing condition to help protect those with a disability to help them maintain their job. Is this not the case? Yes, the FMLA does provide protections and does allow you to take up to 12 weeks a year, whether it's for you or even for a family member, if you have to care for a child or a parent. Where, I've talked to patients is they're been patients that have had to use more than that 12 weeks in a time period. Or also, if I believe I'm correct, it's those that have less than 50 employers.
Correct.
That the FMLA does not apply, so you may not have protection.
And less than 50 employees who live within a 5-mile radius of where you work. So like my situation, I'm not covered by FMLA because my main office is in Virginia where they have more than 50 employees. My office has 3 employees. We're not covered by FMLA.
Right. So, there's a lot of people that work for smaller companies and they're not, there's some companies that will go ahead and provide that to them, but not everybody does.
Right. And again, we're talking about the federal law, which is state. With the federal, there is actually in California a FMLA provision that's a little bit more liberal, I believe.
Oh, for the state.
Yeah, for the state. Right. Okay, who qualifies for CHIP? Children. Does CVID qualify you? Is it based on income? Yes, it is income-based, but it's not as strict as traditional Medicaid. They've expanded. You might want to think of it as expanded Medicaid for children where the financial guidelines are not as strict. Again, the quickest way to find out is to go to that healthcare.gov, put in your information, and it will tell you whether or not your children are eligible for CHIP or not.
Okay, and this one says, I'm concerned about impact of the repeal and replace and COBRA. If the ACA is repealed and I waived COBRA and my ACA plan is gone, can I go back and pick up COBRA?
Unless Congress changes the law, no.
Correct. That was clear.
That's the answer.
Right.
Okay. If you have private insurance through spouse and you also are a PID patient under 65, has Medicare, what insurance is primary? That's really complicated. In general, and again, remember I talked about rules and then exceptions to the exceptions, but in general, if your spouse is working for an employer with 100 employees or more, the group health plan through the employer is primary. Otherwise, Medicare is primary. And you're more the expert on that than I am. Does that sound about right?
It's right.
Okay.
The employer side. Okay, I'm going to do one more and then I have to go. This one says, can SSI and SSD require you to send all your medical records, or are any of those records protected by HIPAA laws?
Actually, they're protected by more than HIPAA laws. Social Security regulations themselves have very strict confidentiality requirements that state that they cannot re-release those records for any purpose. I will tell you that in terms of me as a representative, I am now legally required to furnish all medical records that I'm aware of. If you are unrepresented, could you withhold records? I suppose it's probably not to your advantage. If the judge finds out, he'll almost certainly deny the claim. And like I said, there's really no concern with redisclosure because the protections that the Social Security Act has for people providing medical information to that agency are actually stricter than HIPAA. Okay, Larry's coming up. He's about to run me out.
Yeah, Larry and I have to go for another presentation.
And somebody will use this room.
Yeah,
Okay.
so we'll have to step outside.
So I was going to say, anybody that has questions left, please see me outside. Also, my contact information on the screen. Call me.
Yeah,